BC's healthcare system told Regan Johnson that he should prepare to spend the rest of his life in a wheelchair because the healthcare system couldn't do anything to help him with his back problem. So Regan went abroad and got surgery, and as you can see, he's doing quite well. Today we're going to hear his story and talk about solutions.
Hi, my name's Regan. I'm a survivor of the Canadian medical system. The problem started when I was, I think I was 20 years old. I was working in construction with like a lot of other young people. I went to make my mark in the world, and you don't want to disappoint anybody. So, you work hard. Unfortunately, we came from the generation, like I said, that believed that whatever doesn't hurt you makes you stronger. And when my back started to hurt, I just kept on going to work. You take an aspirin, and then you take a Tylenol.
Eventually, the pain became too much for Regan to ignore. He couldn't even do simple tasks that you and I would probably take for granted.
And eventually, I realized I can't reach my shoes to tie them. So I figured at that point, I should really go talk to my doctor. And when I walked in and I told my doctor what was happening, he just shook his head and he goes, "You're in a lot of trouble." And he said, "You're gonna have to see a surgeon right away." And he started the process immediately, but I was still not able to see a surgeon for about 7 months. At that time, the surgical options were limited.
When this took place for Regan, spinal fusion surgery had recently been removed as a treatment option. This new treatment, which replaced it, was called a disectomy. The surgeon will go in and physically remove the part of the disc that is protruding out and hitting the nerve, which is causing the pain. So, how many years did the healthcare system in Canada take to give Regan the treatment he so desperately needed?
That surgery took almost 3 years to take place. During that time, I couldn't work. I jumped through all the government's hoops. I went to physiotherapy. I was not able to make a living because I could barely walk. It was really not good. And then eventually I did get my surgery. And I remember when I woke up from that surgery, the doctor telling me that only one disc looked really bad, so we left the other one alone. Let's just say that that should not have happened. And then 1 year later, after that, I had to go in for the second surgery on the disc that was right above the first one. And so that was my 2 discectomies that I had here in Canada.
Regan was able to return to his regular life after the disectomy. However, there was one vital thing about the surgery that they didn't tell him.
What they don't tell you about the surgery, the discectomy, is that it's a temporary solution. And just like any other temporary solution, it just masks the immediate problem. The disc, because it's already been damaged, continues to shrink over time. And because it's also not fused, it keeps on moving. So I would periodically pinch a nerve, for example, which could make a leg not work, or just put me in a tremendous amount of pain. And that was for over 20 years. I had lost feeling in my legs. Trying to explain that to doctors was almost impossible until they let me take the needle and I stabbed myself repeatedly, explaining that I cannot feel my legs. I could feel the skin, but I couldn't feel anything below the skin. And when I say I could feel the skin, I could only feel that something was touching my skin. I couldn't tell you if it was a beach ball or a needle. And I couldn't tell you hot or cold, which can be a problem when you get in the shower in the morning.
Regan started to experience severe pain, which led to a severe dependence on powerful drugs.
From 2019 and through 2023, when I had the surgery, the pain and the amount of drugs I took exponentially grew. It went from having 2 bottles of Oxycontin a year to 2 bottles a month, at least. And during that last year, that wasn't enough, to be quite honest, but your body can only take so much of the drug. And sadly, even with that much of the drug being taken in, it didn't help with the pain. It was so bad I would ask coworkers, are my legs on fire right now? And I would make a joke of that because it literally felt like my legs were on fire.
Things took a turn for worse in 2019 after a yoga class. Regan felt something give in his lower back, causing him to go to his doctor.
And they said, we can do a surgery, but we don't know if it'll help. Well, you can't remove what's not there. There is no bulged disc there to remove. It's bone on bone, and the channel in which the nerve is going through is now so out of place, it's getting crushed. So the surgery here could not help, and the doctor at that time told me that I better prepare myself because I'm going to be in a wheelchair soon.
So this is what you have to look forward to. Thank you very much. Here's some more drugs out the door.
They told me that that's what I had to look forward to, and they offered to get me off of Oxycontin and start giving me methadone instead because it would help with the pain more.
Regan refused to accept that his fate was to end up in a wheelchair dependent on pain medication. So he took matters into his own hands.
At that point, obviously, I was in a very desperate, backed into a corner situation. I'm looking at a life of methadone, heading towards a wheelchair, being told that I would not be able to walk. They also told me that while I would lose the operation of my legs, the chances are my back would still hurt. That's a fun one. And luckily, when I was going through my deep dive of desperation online, I came across artificial discs because I was looking everywhere worldwide, everywhere from options in Mexico, India, Taiwan. So I followed the artificial disc, and it led me to a company called ONZ in Germany. And they offered me not only hope, they offered me a solution.
Through sheer grit and determination, Regan was able to get in contact with a team of professionals in Germany who specialized in his medical problem.
In my case, it was a little over 33,000 euros, which worked out at the time to be about $63,000 Canadian, which obviously is a huge shock to anybody. And, you know, you can be as angry as you want about having to pay for it, but my options are as follows. Stay in Canada and be in a wheelchair within a few years, or get some money and go get surgery.
When Regan arrived in Germany, he was very surprised by what he encountered.
Quite frankly, I was shocked by the experience going to Germany from day one of meeting the person at the airport to the courteous staff at the hotel, at the hospital, the nurses, every single person along every step of the way, from the rehab center, the hospital, the hotel staff even. When you move from the hospital after your 1 week stay, you go to a different hospital in a different city, and they have a 5-story rehab center that is connected to a high-end hotel. And you stay in this hotel in a beautiful room with the person that's there to help you.
Thankfully, Regan's surgery abroad appears to have worked, and he is enjoying mobility in his back that he hasn't had in years. But it hasn't been easy for his personal finances and for the lack of help from the Canadian healthcare system. There's a couple things that the government can do to help. First, be accountable. The government was quite happy to take Regan's tax dollars year after year and promise him health care. Yet, they were going to leave him in a wheelchair for the rest of his life, popping painkillers. That's not health care. When our healthcare system fails patients and patients find solutions abroad, provincial governments should be prepared to support patients financially. The second thing the government can do in Canada is get out of the way. We spoke with the German healthcare company that helped Regan, and they told us they looked into expanding into Canada several years ago, but there was too much government red tape, so they gave up. This is why patients have to go all the way to Germany for help instead of being able to get it right here in Canada. Patients would benefit if Canada kept our public healthcare system but allowed patients to pay for surgery at local nonprofit or private clinics. With the exception of Quebec, people are generally not allowed to pay for surgery in their own province. Removing this type of barrier and barriers that keep clinics like the German one out of Canada would help improve access for patients. Similarly, if governments removed barriers to private health insurance, then some patients would choose to purchase that option, just like some people purchase insurance for dental or eye care. To learn more about healthcare reform, please visit secondstreet.org and don't forget to hit that subscribe button.